If you're a new nurse who's just about to start working in an emergency department, or you're just a couple of weeks in and you're feeling stressed and totally out of your depth, this video is absolutely for you. I've been an emergency nurse for 10 years, but I still remember those first couple of months where, God, I thought that I could do nothing right. So I've produced this video with a couple of tips that I hope will help ease your transition into what it's like to work in an emergency department. I'm currently an educator at one of the big hospitals down in Australia, and I know the tips that I've got inside this video will help at least make you feel a little bit more comfortable. Just excuse my crazy hair. I've just come home from a shift and this is what I'm dealing with. My first tip is to listen to that nursing intuition. If something doesn't feel right, it's probably not. If you're reading a medication order and it doesn't look right, question it. If you're looking at a patient and they just look really unwell and you're feeling really uneasy about it, tell someone. If you've been asked to do a task that just doesn't fit with your patient's presentation, ask the question. Confirm with the physician if this is really what they want. Sometimes it could be an error, but it also could be a gap in your nursing knowledge. We're pretty new to this nursing game, so there may be a little gap in your knowledge that you haven't quite figured out how that task matches up with this patient's presentation. So don't be afraid to ask the question if something just doesn't make sense. My next tip is to introduce yourself to everyone, from the cleaners to the patient services assistants to other nurses to doctors. Be the friendly, happy face around the place, because at one point or another, you are going to need some help. You want to make the decision for someone to help you a simple one. So if you were kind to them in the past, they're probably more likely to help you out, right? So be friendly. If you're enjoying this video so far, consider subscribing to our channel. We talk all things shift work and night shift health, which is often assumed knowledge when we start these jobs. If you're anything like me, I had no idea what I was doing when I started my first nursing job. So if you need some help in this area, consider subscribing to the channel. This next tip is to have your break. Now, I have worked the shifts that it is absolutely nuts and you cannot even think about the next task you need to do because you've got so many competing priorities that having a break is the last thing on your mind. But I'll tell you a little secret. You probably will be able to work through those tasks with a lot more ease and less mistakes if you've put something in your belly and you've gone to the bathroom. Holding on for 5, 6, 7 hours is doing you absolutely no favors. And talk about a distraction. Now, while I'm an advocate for all emergency staff to have their full break that they're allocated to, I do understand the reality of emergency medicine and you just can't have a break sometimes for that long. So on those shifts, what I recommend is just spending even 5 to 10 minutes away from the floor, going to the bathroom, putting something nutritious and sustainable and delicious in your belly, having a big glass of water, and keep that brain of yours hydrated so you can actually think about what you're trying to do. As a new nurse, your brain is exploding with information. And if you don't have even one of these little micro breaks, there is a high chance you're going to make a mistake. And I don't want that for you. And I don't want you risking your license. Don't be embarrassed to tell someone if you do need a break, and be very cautious of the culture in your emergency department that you're working. If people are consistently skipping their breaks, try not to get sucked into that. You're not a hero if you skip your break. A wise nurse once told me that it's the smart ones who know when to have a break, who know when they need to step away, otherwise they're going to make a mistake. Now, this next tip is to ask questions that you can't find the answer to. Now, this differs a little bit from the advice you hear people giving to new graduate nurses to just ask questions. Ask as many questions as you can. Before you ask a question when working in the emergency department, use your resources around you before you ask the question. So for example, if someone's asked you to take a lab or a blood test for someone and you don't know which tube to use, is there some sort of online resource that you can use to look up this information before you ask someone or confirm with someone? If you've tried to find the answer and you just are coming up empty-handed, ask someone. But instead of just asking them and accepting the answer, ask them, how did you know that? Where did you find that information from? This next tip is one you probably won't hear from many people because it's often assumed that we know. And that is how to actually be a healthy shift worker. When I was a brand new graduate nurse, nobody gave me advice on how I can best sleep during the day, what I should eat on night shift, when I should eat on night shift, how can I fit in exercise when I'm working multiple days in a row? And how am I meant to maintain friendships with people who aren't nurses? That's why we've created this entire YouTube channel and our blog called The Other Shift to help you answer these questions. As a new nurse who's just starting to work the shift work schedule, you might not understand how hard it can actually be. So keep us in mind, consider subscribing to our channel, and whenever you feel like you're struggling with something, we've probably answered your question because I've been in your position before. So have a look at our other videos you'll find on this channel, and also feel free to jump onto theothershift.com and have a look at our website. Use the search bar on the top right corner of the site and see what blog posts you can find to answer your questions. My next tip here is to never stop asking why. Don't get into the habit of this task merry-go-round where you just do things because someone's asked you to. Slow down a bit and ask yourself why they're asking me to do this. What is the point? If finding out what my patient's urine is, why is this important for their overall diagnosis? Keep thinking broadly about why they've come in. Remember, most emergency patients, it's a mystery why they've come in, and we need to do little investigations and excellent assessments to figure out why this has happened. As an educator, this is my number one thing that I talk to my grads and new students about. I always ask them why, and they get so annoyed with me, but I'd like to think that I'm trying to build your critical thinking skills to really understand what is happening and what has caused that patient to present. My next tip may seem a little harsh, but we can't assume that something's been done, or we can't assume that the patient has done something that you think they have. We have to be diligent and do our own assessment and not rely on somebody else. While we can trust our colleagues, we can't necessarily assume that they have done the task that they said they were going to do. The nature of an emergency department is things get busy. People get sick, and the schedule that you thought you were going to follow for the rest of the shift sometimes can just get thrown in your face. So really make a point to have clear documentation and chart something as soon as you've done it. Don't tell yourself, oh yeah, I'll document that later on. Don't do that. That's when mistakes happen. Kickstarting your nursing career in an emergency department is pretty tough, and I commend you for giving this a go. And I hope this video was helpful to give you a couple of tips. I was going to dive into time management and lots of other sort of practical on-the-job tips, but I thought I'll give you a couple of different things that you might not see on other channels. So I give it to you for even jumping on YouTube and trying to better yourself. And I wish you all the very best as a new registered nurse. Thank you for checking out this video. Now, just before you go, last week I published a review on SuperGreen TONIK, which is a really simple way that you can stay healthy as a busy registered nurse in an ER. I'll link that above my head, so check that out. Enjoy your next shift, and we'll see you at the next video.